Okay, well, what I was saying was that I learned in my career that there are two conversations going on in the dental laboratory. There's the conversation that goes on between the doctor and the patient, and then there's the conversation that goes on inside the patient's mind. And it's important that the doctor let the conversation that's going on in the patient's mind go on without interrupting it. So I used to tell my staff and train them to not interrupt the silence because they were actually interrupting that conversation that was going on internally with the patient. And I did that just because there's many times when patients are making decisions and they're having a conversation, or they're asking themselves questions, or they're developing what's important to them, I think. And if you interrupt that, you'll take them off their focus just when you shouldn't. Make sense?
Yeah, so when did you talk to them again?
Well, I didn't talk to them again until they spoke. It took me a while to get comfortable in the silence, because silence can be very uncomfortable to people who are sitting in it. So my staff, or even early on, I would want to fill the silence in by answering the question for the patient. You know, let's say I said, you need to have a crown. And the patient would say, well, how much does the crown cost? And I'd say, well, the crown costs $1,000, and you're fortunate because you have some dental insurance, and it costs other people $1,000, but it only costs you $500 because you have insurance, so it'll cost you $500 out of your pocket. And then I would be quiet, and then you could see the person shift their gaze away from me into the corner of the room, or to the ceiling, or somewhere else. And you have to know that person is speaking to themselves, and they're having a conversation that could be about anything. You have no idea what this conversation is. It could be about, how am I going to tell my wife that I'm going to spend this $500? Or it could be, I remember Sally Jane told me that crowns are terrible for you. Or it could be, the internet said crowns are junk and you should never do it, you should just have them pulled. You don't have no idea what they're saying. So if you try to guess what they're saying, you'll usually be wrong. And you'll take them off their topic and then give them a reason to not face their own concerns. So if you said the patient said it's $500, and you sat there in the silence, and then you couldn't take it anymore, and you finally said, is that too much money for you, to the patient? Well, it may be, that's no reason why they're not going to do the crown, but it was an excuse. You just gave them an excuse to say, yeah, it's too much money, I won't be able to do it. So you have to sit through that silence and let them talk. I had an assistant who couldn't stand the silence, and she'd say, do you have questions about the crown, or are you worried about being able to pay for it? Because she would just constantly guess what the conversation was, and it would wreck. So I had to tell her to be quiet. She struggled with that, but that was a big deal.
Okay.
Well, again, what I was saying was the easiest kind of practice to develop is an emergency practice, or practice where there is a constantly acute problems. The patient walks in the door with a need on their mind. They sit down in the chair and they say, I want you to fix this. It's a swollen tooth, or it's a cavity, or it's a toothache, or it's a broken tooth. It's harder to develop a practice that the patients are on a higher scale of sort of intelligent awareness, that they want to be proactive about their teeth, and they want to be preventive, or you want to educate them as to why they should listen to your expertise. It's very simple to have a practice where the patient already knows they have a problem. That's easy. It's hard work because it's all about volume then. It's just about finding enough people with dental problems, and they're more interested in their tooth being fixed than repairing it or fixing the mouth as a whole or preventing the next one from doing the same thing. They're real focused on the emergent problem. So the challenge I think to the young doctors is to avoid that I suppose it's taking the easy path of just developing an emergency practice where the insurance pays, and the reason is they'll get burned out, they'll get tired of constantly dealing with people in pain who are grumpy and crabby, and they're not thankful or grateful, and they don't refer other patients in the door because the only patient they would refer in their mind would be someone who had another problem. So trying to develop a practice where you're educating the patients as to why they should be taking care of their teeth is important, and that's why it's important that you, at the beginning of your relationship with the patient, try to get them educated and connected to what your philosophies and values are for dentistry. That's what I was talking about.
So you think the important thing for developing a full range or a bigger practice is to learn the people skills necessary to help them make decisions? Is that what you mean?
Yeah, that's a good way to put it. I think everybody who graduates from dental school is technically capable. Some are really, really quite good at it technically, and others are very average at it. But everybody who graduates from dental school can do skills technically that the vast majority of the population can't. So that's why it's important. That's why it's not about how well you can do a crown or how great your margins are or how pretty your fillings look. It's about developing relationships and improving the awareness of your patients and getting your patients to be aware to the point where they think having healthy teeth and gums is a priority and a value in their life, and why they should do those things you're recommending. So people skills is much more important in developing a successful practice than technical skills.
So obviously upon graduation from dental school, you felt a need to, after a while, to increase your people skills. Now, how did you go about that?
Well, I went to a lot of classes, read a lot of books, took a lot of articles, listened to a lot of senior doctors. I used to go to lunch with some of the other guys in town who had been around the block a little longer, and they were willing to share that every one of us can fill teeth and crown teeth, but I would listen to their techniques, more about how they spoke with the patient, how they interacted with the patient, how the patient went through the office, than about how to do a faster crown or a better crown or a cheaper crown that was more of my focus when I was practicing. Because there's no way you can be so technically talented that patients love to come to you. The only reason, and even when you develop your communication skills, they still don't love to come to you. They would rather go to the beach or go shopping at the mall or watch television than be having their tooth repaired. So it's about being able to be in the middle of that discomfort and do it well, and that's what sets you apart from everybody else out there who's just fixing problems.